to talk about shoulder rehab. Right now I'm working with a 45-year-old male. He just had reconstruction of rotator cuff on his right shoulder. He was in a sling for 4 weeks. He came out passive range of motion only. Okay, this machine is perfect for him. He gets in the machine, we set it at a low resistance, he holds on here, and he gently holds on here, and NuStep also has a nice adaptation glove where he can just hold on there, so he's not gripping at all, and it just rests on there. I don't happen to have them, but they have them on the website. You can order them, and you just simply work the range of motion very gently. Okay, now the nice thing about this machine is so smooth, and you can do short range, and as it feels better and it loosens up, you can increase the range of motion, and it's always in a pain-free mode. Okay, and we'll work into this after 2 or 3 visits of this, and the orders are for active range of motion strengthening. Well, then I give the instructions, okay, start using that arm. Start working a little bit, using the legs and the other arm to help and get that stronger. Okay, and as we're doing that, I'm checking range of motion and doing the other things that are necessary. The next step for strengthening is to get the seat position right. The feet go off and on the floor, and then we just work 2 arms. We start at level 5 in this case. Okay, again, we can use a pyramid system, work it up to 10. When it gets up to 10, 1 minute each level, we go back down for a cool down, and at that point it's time to go the involved arm only. We get this one out of the way, keep the feet there, we start down at a low resistance. At this point the patient is independent. He knows how to adjust the seat, he knows how to work the resistance, because the more independent a patient is, in my point of view, the better treatment they're getting. They're taking care of themselves, and that's the whole goal in healthcare, is so an individual can take care of himself. And we're going to start building up, and again, we increase the range, and I'll be helping him here so he doesn't have to work this, get to the resistance with the involved arm, and we'll go up to level 10 at the time that's allowed, or whatever I feel is appropriate and what he gives me feedback for. Okay, at that point, he's strengthening in the sagittal plane. The next step I use to do is that rotator cuff motion, the internal and external rotation of the humerus, and I love this machine for this. You take one side, you bring it all the way out, and you get the person facing into the hand grip here, and set the resistance appropriately. Have the person elbow in by the ribs, okay, and you start working this motion. And as all therapists know, we're working rotator cuff here to get that joint to stabilize into that glenohumeral joint, and you make it a solid joint with a nice smooth motion. A lot of times patients will start doing this, and they bang it up against it, and it's not right. That's not the way to use the machine. And I get so excited about this machine I can hardly talk, but we work it. I'll go up to 5 minutes as tolerated, and a lot of times I'll even have to do the good arm, because it's a good exercise for the other arm as well, and the patients usually say, maybe I should do this for the other arm, and I say, go right ahead, we've got some time, let's do it. Okay. At that point we go on to the higher level, but this is where we start with the NuStep machine on this particular shoulder surgery.